Christian. Welcome back to Tuesdays with Timeless. Today, I'm talking about fractional CO2 laser. This is an outpatient laser procedure. It's the gold standard for rejuvenating skin by improving texture and tone. The laser applies a series of energy pulses that produce microscopic holes in the skin. This stimulates the body's natural healing response. The body heals those holes from the outside in and the bottom up by producing brand new skin cells that contain brand new collagen and brand new elastin. And this tightens the skin and smooths it. This can be done on the face and on the neck, and it can target particular areas of concern like the mouth and the eyes. However, if a patient has an area of particular challenge, like a mouth or the eyes, I always recommend doing the full face first and then concentrating on the mouth or the eyes. Why is that? That's because if we're going to dramatically improve the texture and the tone in a particular area, like the mouth, I don't want a line of demarcation where that new beautiful texture and radiant skin meets the old skin. I want all of it to be beautiful and radiant with the new texture, and then to be able to concentrate on the area of particular challenge. So what are the results? Well, this new collagen and elastin thickens and tightens the skin, and it results in a more radiant complexion with improved texture. And the results continue to improve for months after the procedure. So why do I think we're particularly good at doing this? And I do. The first is the machine I use. I use the Smart Skin Fractional CO2, and it allows me to vary every single variable. And that's important because no two patients have exactly the same skin, so there are no presets. And I can change every single variable for each individual patient. That means I can truly individually tailor the procedure for that patient, for their texture, for their skin thickness, for their particular challenge. Secondly, I didn't come at medicine from a biology major. I was a molecular biophysics and biochemistry major at Yale, where I studied lasers intensively and fell in love with them there. Then I was an OBGYN, and I was among the very first physicians that used lasers in medicine. I did my first laser procedures back in 1988. What was the first laser I used? CO2. But the lasers that we were using then were ablative CO2s, which means that they destroyed everything in their path. That's very different from the fractional CO2s. Remember what I said? The fractional CO2 applies pulses of laser energy that produce microscopic holes. Well, those holes are surrounded by normal, healthy cells, and that's what results in the accelerated healing. Back in the late 80s, they weren't leaving any healthy cells behind. We were using this on the cervix of women who had precancerous changes but wanted to retain their uterus for future fertility. So we were completely destroying everything that had that precancerous change. We didn't want to leave any of that, and we left a margin of normal cells in the cervix. So we were intentionally being destructive. That's very different from doing a cosmetic procedure. By the 90s, the ablative lasers had improved enough that there were some sort of fringe people who were using them for cosmetic procedures, but the downtime was 3 to 6 months, and patients were in burn units for a while, and then they were in a hotel adjacent to the hospital for a while, and the complication rate was extraordinary. That is very, very, very different from what's happening with the fractional CO2 procedures. The downtime now is about 5-6 days for the most aggressive procedures in my hands with our protocol. So the next thing that changed with laser physics was the development of non-ablative lasers. And those are the lasers that treat hair and veins and enlarged pores and brown spots. And we have those lasers, and I really enjoy them. But I am particularly fond of our fractional CO2 laser. I've done hundreds and hundreds of these, and we get great results. And part of that is our protocol. We establish a therapeutic partnership with our patient at least a week beforehand. And we get patients to change how they eat, how they hydrate. We get them to start an anti-bruising protocol, which means changing what supplements they're on and adding some others in order to avoid bleeding during the procedure. And so their skin and their body are truly ready for the procedure. We also have them start using some particular products. And then we have an absolutely specific step-by-step recovery plan afterwards. And I think this therapeutic partnership is part of why we get such great results. So if you're interested in an outpatient procedure that's the gold standard in non-surgical skin rejuvenation for improving texture and tone, give our office a call and we'll have a consultation together and discuss what are your challenges and what are you trying to achieve, and then how to do that. If you have any questions about what I said today, comment below. I look forward to talking to you again next week. Stay well.